Welcome to my Health Zaroori channel, where I talk about various medical topics and answer your questions. Today, I'm going to talk about methotrexate, a medicine that is used to treat different inflammatory conditions such as rheumatoid arthritis, psoriasis, psoriatic arthritis, and some types of cancers. Methotrexate is a type of medicine called an immunosuppressant. It slows your body's immune system and helps reduce swelling inflammation. It works by blocking the body's use of folic acid, a vitamin that is essential for the growth of certain cells, especially cells that reproduce quickly, such as cancer cells, bone marrow cells, and skin cells. Methotrexate can be given by mouth or by injection. The normal dose is 5 milligram to 25 milligram per week, but the dose and frequency of methotrexate can depend on the conditions being treated and how well you respond to the medicines. Your doctor will monitor your blood test and adjust your dose accordingly. You may not need to take methotrexate every day. Some people have died after incorrectly taking methotrexate every day. You must use the correct dose for your conditions. Methotrexate can cause serious or fatal side effects. Some side effects include nausea, tiredness, fever, increased risk of infection, low blood cells counts, and breakdown of the skin inside the mouth. Other side effects may include liver disease, lung disease, lymphoma, and severe skin rashes. People on long term treatment should be regularly checked for side effects. You should not use methotrexate if you are allergic to it or if you have alcoholism, cirrhosis, or chronic liver diseases, low blood cell counts, a weak immune system, or bone marrow disorder, or if you are pregnant or breastfeeding. Methotrexate may cause injury or death to an unborn baby and should not be used during pregnancy to treat arthritis or psoriasis. However, methotrexate is sometimes used to treat cancer during pregnancy. Tell your doctor if you are pregnant or plan to become pregnant. Methotrexate can harm an unborn baby if the mother or the father is using this medicine. Methotrexate can also be given in combination with other drugs like tufasitinib for the treatment of autoimmune disease. However, methotrexate can interact with other medicines, vitamins, or herbal supplements. You should tell your doctor about all the medicines you are taking or plan to take before taking methotrexate. Some drugs that can interact with methotrexate include aspirin, ibuprofen, naproxen, antibiotics, antacids, folic acid supplements, and vaccines. Methotrexate is one of the mainstay of treatment for inflammatory forms of arthritis. It not only reduces pain and inflammation, but it can actually slow down damage and disease progression over time. That's why methotrexate is known as a disease-modifying anti-rheumatic drug, DMARD. Methotrexate is also used to treat severe psoriasis and psoriatic arthritis, some types of cancer, by killing abnormal cells that grow too fast. Methotrexate can improve the quality of life for many people with these conditions. I hope you found this video informative and helpful. If you have any questions or comments about methotrexate, please leave them below. And don't forget to subscribe to my channel for more videos and on medical topics. Thank you for watching and see you next time.